Thank you for joining us for today's E-Referrals to the Sydney Local Health District Healthlink SmartForms webinar. I would like to start by acknowledging the traditional custodians and sovereign people of the land across which we work. I recognize their continuing connection to land, water, and community, and pay respect to elders past, present, and emerging. I also extend that respect to any Aboriginal colleagues who may be joining us today. Tonight, we've got two speakers. Paul Bennett, Program Manager, Health Pathways Sydney and Sydney Local Health District GP E-Referral Project. With over 30 years experience as a registered nurse and health manager in the United Kingdom and Australia, Paul has been the manager of the highly successful Health Pathways Sydney program, supporting general practices since 2013, and is also responsible for the delivery of electronic GP referral system to Sydney Local Health District Hospital and Services. Our second speaker is Sarah Friend, E-Referral Project Officer at Sydney Local Health District. Sarah is a registered nurse and has been working on the E-Referral project since its inception, trialing different general practice and service referral products. Please welcome Paul and Sarah.
Thank you, Alex, for that introduction. I too would like to pay my acknowledgements to the traditional owners of the land in which we are all meeting, and pay respects to elders past, present, and attending this evening's event. So thank you. So what we'd like to cover off today is to give you a bit of a potted history of electronic referrals as they are set up for Sydney Local Health District, and also give you the opportunity to view how to lodge electronic referrals from your practice software, and where we are going next in terms of providing electronic referral forms to general practice, to Sydney Local Health District ambulatory care services, etc. So as an adjunct to the Health Pathways program, we were picking up a lot of information from general practice about the kind of the annoyances with using fax systems. So as part of that, we started to explore the viability of using electronic referral back in 2017, and we trialed a couple of different products into various services such as haematology, gastroenterology, with a number of practices across the inner west. And in 2018, after some lengthy sandbox experiments, we decided that Healthlink SmartForms was probably the most viable tool for provision or for providing general practice, electronic referral, secure messaging, etc., into Sydney LHD. So across the back end of 2018 and through 2019, we started to issue sets of referral forms across our hospitals, so RPA, Concord, Canterbury, etc. And with that, we increased, I suppose, the connectivity of general practice to those services. The main aims for delivering e-referral was, as I said earlier, was about a secure process and a well-governance process for bringing referrals, so that you as a general practitioner, number one, the ease of using the forms from your practice software, where we wanted forms that would predominantly auto-populate with all of your practice information, the patient demographics, and that would leave you time then to build that clinical picture. Was also going to be able to be a vehicle for delivery of pathology radiology results as part of that referral. But most importantly is that it will acknowledge that those referrals have actually reached their destination, and as part of that, to provide you with direct notification of the triage outcome, etc. So Healthlink SmartForms for us had to be compatible with the main practice softwares that were evident in Central Sydney, and that being Best Practice, Medical Director, with a little bit of Genie. And what was also important is that GPs had a growing familiarity with Healthlink. When we started using Healthlink, Chris O'Brien Lifehouse was already connected to Lifehouse. Roads and Maritime Services for your driver health assessments was also there. And over the time that we've been doing this, my aged care has also connected to Healthlink. So it was a platform that was growing in familiarity and was accessible for the large majority of general practice. Next slide, please, Sarah. So as I said, from 2018, we started bringing services, and what you can see on your screen now is the full list of services by their facilities that you can refer to from your practice software or from the My Healthlink portal, and we'll tell you a bit more about that later. So it is predominantly all of the general medical surgical services. There's a few niche exceptions, and we'll talk more about them a bit later as we develop those forms. But by and large, a lot of the major services are connected there, and there's plans to bring on other services that aren't there quite now. A couple of note would be the COVID-19 monitoring form. As you would all be aware from where we've been over the last 6 months with the Omicron variant, that form has been incredibly useful for general practice to make those urgent requests for remote monitoring from the RPA virtual services and for clinical advice about managing COVID-19 positive patients in the community, as well as our highly used hematology and gastroenterology forms. Next slide, please, Sarah. And where we go next with these, so in the wings we have and will be available to you in the next couple of weeks, and particularly of interest on the COVID side, will be access to the multidisciplinary long COVID rehabilitation service that's just started at RPA, and the post-COVID respiratory assessment service at RPA as well. Both of those are accessible now. Information for both of those services will be on Health Pathways by the end of this week, and the e-referral form should be available in mid-July, but you can refer using traditional methods in the meantime. Then later on this year, we will be delivering a suite of endocrinology pathways for RPA. Concord is already connected, and that will include specific diabetes referral forms as part of that across all of the 3 facilities with endocrinology services. There will also be online or electronic referral forms for hospital in the home, neurosurgery at Concord, and the soon to start virtual fracture clinic. And later on in the year, there will be maternity at Canterbury, as well as more forms for maternity services at RPA, including the pelvic mesh service, fetal medicine, and EPAS as well. I won't run through some of the other forms that are also in various stages of build, such as the sleep at Concord, pediatric surgery at RPA. And next slide, Sarah, is over to you. So I'll hand over to Sarah, who will provide you with a demonstration of how to use Healthlink SmartReferrals. Thank you, Sarah.
Thank you, Paul. Good evening, everybody. So to commence the demonstration, I just wanted to highlight the different entry points to access Healthlink SmartForms from either within your practice software or via the My Healthlink portal if you don't use Best Practice, Medical Director or Genie. So for best practice users, within the patient file, you would select the letter icon. Once the word processor document opens, there's a HL icon, and then from there, My Healthlink Forms will appear, and then you once again select the letter icon as well. For Genie users, within the patient file, you click Tools on the top left-hand side of your software, and then select Healthlink Online. Medical Director users, within the patient file, Healthlink forms part of the tabs that you see within your practice software. So by selecting Healthlink, a list will then appear of any forms you may have previously sent, and a new form option appears. And finally, for My Healthlink portal users, so this is available for GPs, but also allied health practitioners that may not have access to any of those 3 software systems. Once the portal is open, you simply select the new letter icon as well on the left-hand side of the screen. So once you've opened Healthlink and follow those steps, what will appear is the referred services list. So from here, you will see services that you have access to. So this is our test environment. So you're seeing lots of different services that are available across Australia. But for Sydney Local Health District, we do have 2 links. So Sydney Local Health District Services, just here on the right-hand side of the screen, is our main list and has 59 services that are currently connected. And a new link that's been developed for RPA maternity, gynecology and fertility is the Sydney Local Health District Women's Health Link. So the reason why we have the 2 links is we're actually trialling a new referral management system on the hospital end. So the 2 links coexist for services to our hospitals. So I'm just going to jump into Medical Director, and please indicate if you can't see my screen. As just demonstrated before, once the referred service list appears, we have our different options. So I'll demonstrate the maternity form this evening. Once selecting women's health, the services will appear on the left-hand side of the screen, and this is the same for if you access any of our other services. Select maternity, and our facility is RPA, and click continue. So once the form's launched, you'll see on the left-hand side of the screen, the form's actually made up of a number of different tabs. So the first tab, request information, contains information that's specific to the maternity service at RPA. And from attachments and reports onwards, these tabs are auto-populated from your practice software. And if you're a portal user, you have the opportunity to manually enter the data into those tabs. So just to note, as you start the maternity form, the first field we have is actually the preferred model of care. So here you can indicate a preferred model of care that the woman may like to partake in. Just to flag as well, we will have a form update in place in the next couple of weeks that will include the Aboriginal Women and Baby Service, which is a midwifery-led service at Royal Prince Alfred Hospital that you can also select as a preferred model of care. Additional information is also available in the information box for the different models. Anything with a red asterisk is a mandatory field. So as you make your way through the referral, you can select those different fields. We do have an urgent field. So if you have a woman that needs to be seen urgently, what you can do is contact the RPA switchboard and speak to the on-call clinician for the service and just discuss the woman with this person and just note the details here on the form. We do have a number of, standard fields of the maternity form. So as you make your way through, you can enter the data in here, including their previous pregnancy history and any other relevant history. Different selections here will also expand out to include a free text box. There's a free text field for other history, and also fields that you can include the pathology lab or radiology clinic if relevant. Some other standard fields that are included on the forms include consideration for telehealth, special needs and reasonable adjustments for disability, and if the woman has a carer or support person, up to 2 people can be listed here for the example for maternity. If you would like to refer back to health pathways, you can always link from all of our forms back to health pathways under the here link. And measurement details will auto-populate should you have any of these fields complete in your practice software. If there's nothing entered here and you wish to include some data, you can just actually select the field and manually enter the information. Attachments and reports. This is the area where you can attach any pathology, radiology reports, care plans, anything that's relevant for the referral. Healthlink SmartForms support a number of different file types. So with the little box that appears here, this is for documents that are available in the practice software within, I think, about a 6-month period. If the file you're looking for is not here, you can browse for patient document, and this will interrogate your practice software, and you can select the files you wish to attach. In addition to that, if there's any documents you wish to include from your desktop, you can also do that by clicking Browse for Local File. Medications and warnings will auto-populate if you're a BP, Medical Director or Genie user, and you can also remove anything that's not relevant. If you're using the portal and you need to add these in manually, you just click the plus arrow here and can type the details in. And any other fields here that auto-populate, you can just select what's relevant. Medical history, once again, selecting fields that are relevant. And for portal users, this is where you can type in the information. Patient information, as well as captured on the second last tab. If the patient does not have Medicare or DVA, you can select no, and the referral will still be sent through. And other key demographics, including name, contact details, gender, Indigenous status is inputted here, in addition to email, contact details, etc. And finally, the last tab, which is your referrer information, should auto-populate across, including your provider number, your HPI and HPIO, and other practice details, including your HealthLink account name, fax, telephone number, email. So once you're ready to submit, you click the submit button, the top right-hand side of the page. If you would like to park the referral, if you've got additional information you'd like to include later, you can do that, and that will save in your practice software. And you can also preview. So once you have submitted the referral, you'll get a red text notification at the top of your screen, letting you know the referral has been sent and acknowledged. In addition to that, you also will get a number of different notifications saved in your practice software. So any updates post triage or requests for further information will be stored and received in best practice in your correspondence for Genie users in your correspondence log, medical director holding file in my HealthLink portal dashboard as well. Copies of your correspondence are saved in various areas within your practice software. And for medical director users, a HealthLink form submission copy is also saved in your correspondence and progress notes too. Over to you, Paul.
Thank you, Sarah. I suppose we're very much talking about e-referral, but we can't actually do away without fax. And so one of the things that we've been trialing for our maternity service is a different receiving portal than the rest of the services got. And one of the unique things about that new platform that the referrals are received into, it'll actually ingest digitized fax, and we can scan in paper referrals should they still arrive. And this will be there in the long term for any practices that can't undertake electronic referral or electronic referral downtimes and practice software downtimes, but also then for tertiary referrals that come from an area that isn't connected to our electronic referral system. So what we are doing is slowly rolling out across Sydney Local Health District a bespoke fax cover sheets, and you can see the one on the screen there. We've made this available not only through Sydney Local Health District's Women's and Babies website, but via the PHN in a number of newsletters, and we can send that out to any practice that so wishes to have it. The purpose of the cover sheet is literally just to cover off a few particulars and to help the digitization process of sending that referral to the right stream for referral management. It absorbs handwritten text on there or typed, so the option is there for a GP, but we do encourage you, if you're unable to send electronic referrals, to start using the new fax cover sheet, because it does mean that we can host all of our referral activity on the one platform, which makes it easier for management, processing, and for triage and responses back to you then and the patient with triage outcomes, etc. Just on that, and I suppose all of our services are, like yourselves, coming out from 2 years of COVID, and there are backlogs there in processing a lot of this information, and we still have high numbers of our clinic staff kind of unable to work with COVID and all of the flu outbreaks. So our services are endeavouring to respond to all referrals that are a routine or non-urgent basis within 2 weeks, and to acknowledge that referral, and obviously appointments are booked on clinical merit from there. So the one to point out is for our maternity services. If when you are completing a referral to maternity, and the patient is kind of picking up on their pregnancy at a late stage, we do ask that you do point out or include the EDD or EDC as part of that, so we can prioritize if those mothers to be need an urgent appointment outside of other medical issue stuff on that. So it's really important that you do that. The fax numbers for maternity have remained the same, and all of those fax numbers and that information is available on Health Pathways. Sarah? So with support, so if you are a practice that is using HealthLink for the first time and you're a bit unsure, there's a number of access points for support. Number one, HealthLink themselves, they have a working week support line from 8 till 6 o'clock Australian times, and the team on there not only will know your practice, but they'll be able to talk you through the various usage points for the different practice softwares. Sarah and I are also available Monday to Friday from 8 till 6, and we're happy to take either an email to the address that's on there or via our mobile numbers to offer you support there. The wonderful team at the PHN, Alex, and the digital health team are also available as well for that. The information and the user guides are also available on the PHN digital health website, and the main HealthLink website contains all of these guides and usage points. And if you are a practice that isn't connected to HealthLink, they're able to establish a connection for you and set you up with a My HealthLink portal within the matter of a couple of hours, and they've certainly been very busy doing that over the last month, since 2 months since we switched the maternity forms on. Sarah? Secure messaging as a side part to eReferral and the SmartForms. We are encouraging a lot more of the district's departments and ambulatory care services to start using secure messaging. So a good example of that would be the GP Can Share program, which is using that to communicate back to general practice directly, a lot smarter in terms of MDT outcomes for your patients, but the ability then for you to be able to share pathology directly with the service and with the specialist nurses, all digitally and securely, and have those records from that. We will see more services connecting to secure messaging to support your practice over the coming months. Next slide, Sarah. And I can't get away without putting the plug in for Health Pathways. All of the connected services and information on how to use HealthLink and the services is all available on Health Pathways. And again, the Health Pathways team can provide you with support on using HealthLink and eReferral. And again, that's just Sarah and I's contact details. So please take screenshots and please don't hesitate to give us a call with that. And it's also with the maternity one, just to call that one out, Mel Tullock, who is the GP liaison nurse for maternity services, is also available. I think all of you from the antenatal shared care GPs will have her contact details if you are stuck with lodging referrals. So.
Thank you, Paul. Thank you, Sarah. Now is the time to put any questions in the Q&A box, and we do have a first questions there. If you accidentally close the HealthLink SmartForm without parking it, will the referral be automatically auto-saved in the software? If so, is this the same for HealthLink portal users?
Yes, that is correct. So the form will auto-save after a period of time once it's been opened. So as soon as you see that alert saying the form's been auto-saved, if you do accidentally close it, it will be available in your practice software or the portal as well. That's correct.
Thank you. I've got another question, which says, I practice outside of the Sydney Local Health District. Can I still use the eReferrals?
And the answer to that is yes. Obviously, if you are referring to one of our services, so RPA Concord Canterbury, and obviously the patient meets that criteria to be referred to them. If you are within Cessford, you should see the HealthLink links to our services. We've deployed it all of the PHN wide, so that includes GPs in the Shire, Eastern Suburbs, etc. St George's should be able to see it. But it's worth checking next time you're in practice and have a look into your HealthLink portal. If you can't see it, and if you are a GP that's maybe a shared care GP and you do refer regularly to Sydney Local Health District Services, get in touch with us and we can help. We can get HealthLink to reconfigure your settings. So we've seen with some of the best practice platforms and versions of best practice that they don't always pick up without a prod some of the new forms that go on in service listings. So we're more than happy to help with that.
Next question. My software is not compatible with HealthLink SmartForms. Do I need to pay for the portal?
That's a very good question. And a lot of it will depend. If you just take the basic portal for sending referrals, you shouldn't have to pay for that. So if you're just using SmartForms, the Sydney Local Health District, there should be no charge. Sydney Local Health District covers the costs of transmissions in and out as part of that. If you want to use your portal access to connect to other secure messaging elements and to clinicians' private rooms, etc., or other services, there may be a service fee for that.
Thank you, Paul.
I suppose, well, you wait if somebody does have a question. Electronic referral isn't just going to be a flash in the pan. It is going to be available to more and more services, not only in Sydney Local Health District. There are large plans right across New South Wales Health that not only the platform that we've deployed to maternity and RPA will likely be the same platform that gets deployed to all New South Wales public health services. And what they then are working out is what eReferral provider will be out there then in the various PHNs and LHDs that will feed into that platform. That's one of the beauties of the platform. It'll take a variety of different providers' eReferrals, as well as that fax digitization process. But with that in mind, with that in place, New South Wales Health will be in a strong position then to start saying electronic referrals are preferred, and the availability to send faxes will quickly diminish. So I think in about 5 years' time, fax really will be a minority used tool for that. So I think some more questions, Alex.
Thank you, Paul.
So that should come under fetal medicine. And the plan is to get them on board by the end of this year. We've already started discussions with Rita Mulgrew, the specialist who manages that service out of RPA. So hopefully I've interpreted that right for that response.
Thanks, Paul. Well, it looks like you answered everything in your presentation, Paul and Sarah. So thank you a lot for your presentation. And thank you to our speakers, and thank you for everyone for attending. Thank you, everyone, especially Paul and Sarah, and good night.
Thank you. Thank you very much.
Thank you.
Bye.
Bye.